So we're making a tour of the TB treatment village. This is called Alafia Tinga, which roughly translated means good land or healthy land. The patients that we get with tuberculosis are required to stay on site for their TB treatment the entire duration of therapy. Up until last year, we had a treatment program that required them to stay about 9 months, but now we've got a shortened protocol where they can complete the treatment within a 6-month time frame. She's from Cherponi. She's a Chikosi, it's her tribe. So that's around Saboba, south of here. She's just got 1 month left for her treatment. She's doing real well. Nizanuri. Ining binaya wala. Deswaya. Kwahma swaya. Normally they always spend their whole time down here at the TB village. Occasionally we have some hospitalized at the isolation ward, and those are usually the ones that are too sick to come down here. Sometimes we have ones that don't have caretakers available, or they have TB of the spine and they're pretty much paralyzed and they're bedridden, so they have to stay on the hospital for a time. Generally they prefer to stay at TB treatment center. We have about 35 units, housing units down here. Each unit can take 2 patients and their families, so we can house essentially 70 patients, but 2 of the units are for non-patients. One is for the caretaker and one for the overseer, and one's for the young man who stays and works around the compound, Chinny, and his family. So I guess that leaves 33, probably 66 patients maybe that we can house at any one given time. And most of the time we're just about full. Sometimes we essentially have a waiting list for patients to come down here to the TB center. Sometimes we're required to keep people on the wards because there's no room for them at Alafia Tinga. Alafia? No. This lady's been here not quite 2 months. She's still on the intensive phase, and she lacks about a week and a half of being here for 2 months' time. She's got her family here. They're required to have a caretaker whenever they come, so somebody can make sure they are able to be fed and all their needs are met. So generally the families just move in with them when they come down here. So in a compound like this, 1/2 would be for one patient and their family. They have their own cooking area and bathroom. The other side, the same thing, another patient, their family, with room to sleep in and a place to cook. And hospital property is available for the people to use as farming if they're healthy enough to farm. But in the old days, they pretty much grew their own food, so I'm told. But I think now most of them are not in good enough health to farm. Fra nyong, iya fra. Bolika, la wane, la kain, la bebe. She's from Bolga. They are fra people, so that's the extent of my fra dialect right there. Fine. They do try to separate the patients a little bit from those who are on the intensive phase, which is the first 2 months of therapy where they're taking 4 drugs, and the ones who are on continuation phase, they can allow them to have a little bit more freedom. But that's pretty much in a nutshell how things work down here at the TB Center. You got somebody Sinna. Ona bunning sel. Yeah. Guasma. Yeah. Yeah. Voilà. Yeah. Yebo toffee. Fine. Oh, the baby maro. Bye. Yelma bye bye. Eh?